All right, team, we have a patient presenting with pericarditis, rheumatic fever, and periodontal disease. Let's diagnose this case.
It could be rheumatic fever. These symptoms are commonly associated with it.
I disagree. I think it might be related to pericarditis. The inflammation could be causing the other symptoms.
What about periodontal disease? It can also manifest with similar symptoms.
I'm leaning towards rheumatic fever as well. The connection seems pretty strong.
You're all wrong. It's RUD syndrome. We need to perform a parathyroidectomy immediately.
RUD syndrome? As in rapidly unplanned disassembly syndrome?
Yep, the patient had a few too many misadventures with Diet Coke and Mentos. The poor bastard didn't stand a chance and exploded.
We're not talking about that kind of RUD.
That's obviously not what happened. There's little chance a patient would survive the kind of RUD you're describing.
So why are we bothering operating on this patient? Can we even be sure his 6-year-old son retrieved every single piece of flesh in the giant plastic bag labeled Daddy? I don't really have the time to reassemble Darwin Award winners.
Team, I implore all of you to completely ignore what this idiot has just spewed from all of his orifices. His words are of no value, and I won't be responding to any of them.
What kind of bag do you think Amani would fit in?
Oh, shut the fuck up already. It'll be a goddamn miracle if one of us doesn't leave this hospital in a bag in a few days.
Hawks, please have a seat. I understand you want to perform a parathyroidectomy on your patient with suspected RUD syndrome?
Yes, Tracy. I've reviewed all the tests and symptoms. This surgery is necessary.
Hawks, I respect your expertise, but we need to be cautious. You have a history of misdiagnoses.
So what? If the parathyroidectomy isn't the right treatment, then we'll continue investigating this patient's illness.
Parathyroidectomy is a permanent procedure, Hawks. You could be removing a part of the patient for no good reason.
Maybe one of the surgeons has a cat to feed.
I don't know who is saying worse things today, you or Gary.
That's the only competition I'm willing to concede to.
On which one of you comes out of this hospital first in a body bag?
Don't twist my words. I never said that.
Whatever you said earlier sounded like a threat.
It wasn't a threat. It was an observation. One of us will probably leave this hospital first due to natural causes, as is the way of life. Also, it was a figure of speech not meant to be taken literally or seriously. Such as, "Hi, Tracy. You're a nice person today?"
Gary, we have a problem. The patient is in critical condition after the parathyroidectomy.
Oh no, that's not good. I had a feeling it wasn't the right treatment for RUD syndrome.
I should have listened to my gut. We need to figure out the correct treatment for this patient, and fast.
Are we sure this is even the right patient? I was expecting a patient in a more explodey state.
No, you weren't. Drop the bit, Gary. Not a single person is finding any of this funny.
You bunch of incompetent fools. RUD syndrome was a misdiagnosis, and you performed a parathyroidectomy when it wasn't even necessary. Are you all trying to kill our patient?
The patient's earlier RUD condition preempted us from performing the parathyroidectomy, Hawks. Technically, the thyroid was already ectomied.
Please tell us what we should do now, Dr. Hawks.
Yeah, we need to know how to proceed from here.
We're really sorry, but we need your guidance.
You imbeciles wouldn't understand even if I told you. Figure it out yourselves for once. I can't believe I have to deal with such incompetence. And don't you dare touch another patient without consulting me first. So, Johnson, how are things in the oncology department these days?
Pretty busy, but we're managing. The new treatments are showing some promising results.
That's good to hear. I had an interesting case today, though. Can't seem to figure out what's wrong.
What's the issue? Maybe I can help.
I think I got it. Yes, it's clear now. Thanks, Johnson. I have to go attend to my patient immediately.
Wait, you're leaving just like that?
I can't waste any time. Catch you later, Johnson. Sorry I'm late. Had to take care of something urgent.
Hawks, you can't just barge in here without proper gear, you know, the rules. This is a pressurized environment and could cause an implosion.
Yeah, you're putting yourself and the patient at risk.
Listen, I need to talk to you all. RUD syndrome wasn't the diagnosis. It's congenital stromal corneal dystrophy.
Congenital stromal corneal dystrophy? Are you sure about this, Hawks?
Absolutely. I discussed it with Dr. Johnson over lunch. The symptoms fit perfectly.
What's the prognosis then?
The prognosis for congenital stromal corneal dystrophy is better with early detection. We need to act fast. Tracy, I've come to admit that I made a mistake with Rudd syndrome. It's actually congenital stromal corneal dystrophy.
Excellent work, Hawks. It takes a big person to acknowledge an error and correct it.
If only my team had been more competent, we wouldn't have wasted valuable time on the wrong diagnosis.
Wait, Hawks! You were the one who declared the wrong diagnosis in the first place?
One of my idiots literally thought we were talking about rapid unplanned disassembly in regards to the patients.
That is no excuse. Wait, actually, that is pretty idiotic, even for your team.
Do you see what the hell I put up with around here yet?